First of all, thank you very much for inviting me to introduce the Standards of Care project. It's a little bit different from the speeches you have heard this morning and this afternoon. Our foundation is founded in 2008, and outside are a couple of folders to introduce our foundation. So hopefully you know most of our work, what we are doing. We are based in Munich, and we are an umbrella organization in the end of parents' voice, but we are collaborating closely with health professionals, politicians, but also industry partners and other stakeholders to improve maternal and newborn health. And maybe to my own background, I'm a preschool teacher and had myself a preterm birth 18 years ago. The reason was a HELP syndrome, and I delivered twins. One survived and one died, and this is the reason why I'm doing this work now. So EFCNI started, as I mentioned before, in 2008, and our first aim or vision was really bringing parent organizations together to create a voice, to know from each other what is the need. And the fantastic feeling in this room in 2008 in Rome was that more or less everybody in this room wanted the same, had the same or similar experiences. And we heard from countries like Sweden, where the situation is there, and we heard from countries like Italy, Germany, Greece, where the situation was totally different. But in the end, the feelings and the vision and the needs were the same. So we started to set up a declaration. We called it Declaration of Rome. And we had the idea to start with policy work, so to knock on politicians' doors to change the situation. And we had luck that one of the famous one is living in Munich, and over the connection with a butcher, we got an appointment with her in the living room. And so we brought her in her home the 10 points of our needs and our demands. So very self-help group organized at this time, but very soon industry partners, politicians, but also health professionals saw in us a first organization who really wants to change the situation. As you said, Björn, normally you should do it, but you do your daily work in the hospital. And my experience was 8 years the president of a German organization, and I started already as a paid person. So important is as a parent organization, not working voluntarily, really to do this professional. So I gave up my job as a preschool teacher and started full-time to work at EFCNI. And meanwhile, we have 7 people who work full-time for this organization, plus agency work and other persons we have pro bono or we have to work with us, and a lot of expertise we get from health professionals, and a lot of them here from Sweden. So we're very happy that we have all this expertise in our organization. So the idea in 2009 was then a year later, how can we show the politicians what's going on and what is the situation in Europe? And so we got a recommendation to set up a benchmark report to show what is the situation in Europe. And it was, well, in some countries like in mine, in Germany, it was a catastrophe that we were at this time the second worst of the numbers of prematurity, and also Portugal was better than Germany. And you can imagine that in a country like mine, where we are one of the richest in Europe, it's a catastrophe when you get the press and media out of we are the second worst in taking care of newborn infants. So the press was full, and also the reaction was enormously that we then said, okay, we have now the numbers, but how can we change the situation? What are the recommendations to improve maternal and newborn health and the long-term outcome of our children? So in 2011, then we decided to publish a white paper and really start on preconceptional care to pregnancy care to where should this baby deliver, which kind of education should these professionals have, and how should their babies treated and which kind of treatment they should receive, and how should be organized the discharge management, the follow-up and the long-term support for the parents, but also for the children, and what is in the end the outcome of these children. It was a very comprehensive work of over 200 pages, and this was also represented and shown in the European Parliament. And this was then the first time that different stakeholders and health professionals, so from midwife, gynecologists, gynecologists, obstetricians, to neonatologists and neonatal nurses, parents and follow-up experts worked together on this massive paper that they came then to us, and this is what we hoped, of course, why we not start with standards of care. But standards of care, it's a huge and a big project, and it's a big responsibility also, because we were at this time 3 people in the office and one of them was half-time. So how should we really coordinate and organize it? And it's not an organization work what you can do in 1 year. It's a long-term project. So you need all the experts, you need the agreement from different organizations, you need really a lot of financial resources. But we got a lot of support in the last years, and this is what we have done now in Europe, and hopefully it will help also beyond. So why do we need this? And what we found out already in 2008 is that in Europe the situation is, well, the babies are very similar, but the situation in the countries is very different. And this is really what we have found out from the north to south, from west to east. And when you see the situation here in the Nordic countries and you go to Bulgaria, where the parents have no access to their babies, where the parents, when they can, stay there lying on the floor, or we were in December in Greece, and it is heartbreaking to see how the financial crisis is really, really jumping in this country, and babies are staying in hospitals more or less forever because nobody wants this babies anymore, because they cost too much and they can't bring them home. And this is heartbreaking to see. And then we discuss about high-level treatment and care, and we as Germans discuss how we can finance Greece and support them. And then you see the situation in Athens, in the different hospital. That's not where we should be in Europe. So the situation, what we found out also is that all the different things, what you see here, so the infrastructure of the high-risk pregnancy are different in the different countries, the organization, the transport system. We have, for example, in Germany, no centralized treatment and care. We have not the standardized education and training programs. In the different countries are different education and training models. But in Europe, you can change from Germany to Sweden, and you can also go from Bulgaria to Germany. But when you start as a nurse in Germany and you come from Bulgaria, you have a totally different education and training. And it's the same, like our Germans like to go to Sweden, but it's a mess when they start here. They are not so good educated and trained as we would like to have them in Germany. And for example, our nurses need no further trainings after their education in the beginning. So that's a catastrophe when we have a 40-year-old nurse, 20 years, she needs no further trainings. And this is in a country where we drive these big cars and have really a lot of money, and we are not taking care of our patients. And that should really be changed. And why European standards of care are really needed. Why is there nothing existing? And what we found out that there are some standards or some guidelines in some areas, in some countries, but not all topics are really organized and also not transparent for everybody. So there are some medical guidelines, but most of this, what we have heard from Bubu today, is we have no standards in Europe for NICU design, for family-centered care. In Germany, they call them family-centered care when they're covering the incubator. That's family-centered care. When they have one chair for 6 babies, that's family-centered care. And then they have visiting hours, and parents are visitors. We are no visitors. We are the parents. We should have access 24 hours, 7 days a week. And this is not regulated, not in Germany. I don't know how much it is really black and white written in Sweden, but it's not there. And this is why we think we need standards in this area. And it's not easily accessible. That means parents have no access often or no information about existing guidelines. In Germany, we have now a fight on the on a law base, because one mother is fighting now against the hospital because her baby didn't receive any kind of treatment. But this baby was 23 weeks old, and there is a new law that normally the parents need to be involved in this decision-making process. But there was no information before on this. And now she got the information, and now she's fighting on it. But the baby died already. So these are things where we have to really rethink on why we need standards of care. And we have to build a really comprehensive knowledge of all these different countries, of these different continents also. We know from Robert White the standards of NICU design. How can we bring this knowledge to our country? Or the new study from Julie about family-centered care. Why we cannot bring this here to our countries, especially to one who are not speaking fluently English, or most of the people like ours, my country in Germany. And what we have done is we started with the Standards of Care project as a first idea. We discussed over 2 years with experts about their opinion. All of them said we should initiate it because we are more a neutral platform. We are the parents' voice. We get more heard than maybe the health professionals. We also said we have not millions of euros because we are not getting money from Bill Gates, because we are Europe, we are rich, and we want to really do it on a more neutral way and not be influenced in any kind of situations. So for us was then important that the big community of health professionals work with us, and we can't pay them, so all of them work voluntarily, and we are very grateful that we have this expertise and this background of knowledge, so we have our own encyclopedia behind us now. That's fantastic. And we have also worked 2 years for the collaborations with over 50 organizations, really have written agreements to work with us, to support us. And we also plan to have evidence-based standards, but if there is no evidence, like with palliative care, or not enough evidence, like in NICU design, to have experience-based basics for the standards. That's very important. And of course, we would like to benchmark in the end before and after we implement then the standards. Working together means for us really working together. That means in all groups or from all target groups, experts. In all of them are parents, in all of them are nurses and doctors and industry partners and third parties or policymakers. That means why we involve industry partners. Do they influence us? No, they can't. They have contracts with us that they are not able to influence us, but in all of these companies work experts in their field, and this knowledge we need to really develop standards where in the end can be implemented, can be driven from companies. That's very important. Yeah, so sorry. And these are the organizations where you can see different organizations like nurses. You see the big neonatology societies. You see German organizations, fetal medicine organizations. You see NetCap, you see education organizations, policy educations, and here are all the parent organizations of Europe. And we hope that we get more and more organizations step by step involved in the acceptance in the end of this project. And this was a half-year hard work to meet all these people, to knock on all this door, to get official agreements that they accept the way of working what we are planning to do. That was a big deal. And one politician said to us in Brussels, "Oh my goodness, all these organizations supporting you," and he is a pediatrician. He said, "How long did you need? 10 years? I said, "No, half a year," and this was not fast enough for me in the end. And these are the supporting industry partners. All of them have long-term contracts with us. This was the longest discussion at all, not so much with health professionals, but with industry partners, because they have to sign minimum 3 years contracts, and you know they plan year by year. So getting a 3 years contract or longer needs a long discussion, but we got from all of them long-term contracts so that we can realize in the end that the finishing of this project. That was key of us, our plan. We have we have, of course, or work at the moment on the method of this project. So we have expert groups, we have a committee. These are always the chairs of the expert groups. We have supporting organization because we need the feedback if we do maybe nonsense or if there is something what we can never ever realize, for example, in Bulgaria. And so the expert groups are developing the standards and of the different topics groups. And the committees are always the two people who are coming then to the committee, discuss the standards and see, is there more evidence? Is this acceptable? Is this something what we can implement? The supporting organizations, like you saw for all these different logos, they give their review and they endorse the standards if they can accept them. And if the standards are endorsed, so standard by standard, then they are published. So you will see later how we do it, how we publish in the end. So the topic expert groups are in each group between, some are with 6 or 8, how much? 10 is the smallest one, and then we have some who are bigger because we need for different areas different experts. They are drafting. And then we are a parent organization. We need the parents' knowledge. In each of the groups are these purple balloons are parents, but maybe this one is not the expert of this question. So we have a huge knowledge forum of parents of all over Europe and beyond who can then respond to different questions if they have knowledge about it or experience or have an opinion on it. This standard goes then to the committee where it is discussed. Again, there are parents from our parent advisory board. All the chairs are inside, of course, and the vice chairs. There are industry partners and people like WHO as observer inside and part of the EFCNI team. And of course, our project manager, Iris, is inside. So then is there a process to accept it or go back to the group? But this is too complicated to show it here. And then it goes, if it is accepted from the chair committee, goes to the supporting organization. And they again have a timeline where they can give feedback. And we need this way of working. If we have 50 organizations in the end behind, as a NICU design standards, then we can ensure that it is accepted and then we can push it forward to get it implemented. It needs, I guess, till I'm retired in the end to have it implemented in Germany, to have this NICU design like you have it here in Sweden. But this is the way to get maximum acceptance in the different countries. And of course then the endorsement, and it will be then published. So the EFCNI with the executive board and also our project manager is coordinating the project. We have then the different committee members, the topic expert groups, and the supporting organization as a structure. So we coordinate, this is what I already said. And now we go to the different groups. So important is for us, we start not at pregnancy because this is an own standard. So we start, where should this baby be born and how should the baby or the mother, the pregnant mother, be transported? That is where we start the standards. Then the medical care and clinical practice group, it's a huge group which is also split up in smaller groups under this big topic. The care procedures, the patient and family-centered care and supportive, how do we call it, supportive care? The NICU design, nutrition, is included, of course, breastfeeding, palliative care and ethical decision-making processes, follow-up and continuing care, the patient safety and hygiene, the data collection and documentation. And this was before two groups, and now this is one group. We combined this group of education and training because the group said we have to work together so we also can work together on the standards. And this was our dream, but we were too skeptical to put it in one group, and we were very happy as they decided to put things together. So it was the first step where we say, oh, now they got it. And these are the famous name list, and we are very proud to have all these experts working for this organization and working for this really long project. It was about 5 years. And each of this group has a chair and a vice chair, but this is not as a ranking, who is more or less. So it means really that these two people work very close together as a core team and coordinates their working group. And parents are extremely involved in the whole project. It means, as you have seen, the Parents Knowledge Forum is there. So members of the different parent organizations, but also in the end parents who maybe are in the organization or in your hospital, you know them, they are expert in this or that field, can join this forum. They, of course, are representatives of the parent organization in the expert group. The advisory board is in the chair committee, and the parent organizations are the supporting organization. So you have everywhere the parents involved. And this acceptance from all these societies were important because they go now home in a country like Bulgaria, Romania, Hungary, where they have normally no acceptance as a patient, as a parent. And now they can say they are involved in such an important organization, in such an important project where all these key people are involved, and this gives them a really strong voice in their country. And that was very important for us because I know how I started and people loved about me as I started my first presentation on the first Congress. So that's very important for us to give them a strong voice. So what we have done the last 2.5 years is really to think about who should do it, who are the right people, who are the ones who are helping us to drive this big project, what we should do, where we can do these things, where we should present it, why we should do it, why is it important to work together, why is it important to have European standards, and when is the right time to start. And how can we realize this? How can we finance it? So the start was last year in April in the European Parliament, where we had an exhibition on a project, Socks for Life. It's an awareness campaign, and we had there also the kickoff of this project, where most of the presidents of the big societies were there. We had the vice president of the Parliament there, and a couple of key politicians who signed up this project. We had the first chair committee meeting in Munich. You see us in Dirndls, where we had all of the chairs there, and we were very proud that all of them came. So we had to book again hotel rooms because we were totally excited that really all of them wanted to come, and so we were very, very happy that they made or invested the time to stay with us. And we are in the final process of our website. So this standards will not be a booklet, it will not be a PDF in general, it will be website based, because we think it's important that standards maybe will change, that it's easily to change, and we want to offer as much as possible different languages, that we can go really to the basic of the different countries. So the preparation is that we have planned the project in the different levels. We made the discussion and the decision of the structure. This was very complicated and needed hundreds and hundreds of hours to discuss this with everybody. And if you ask two people who have minimum 3 different opinions, so it was not easy to find the right way, and we are in some areas not in the final decision. And we decided, of course, the different topics. And also there was a big discussion of some organization, why you have not this inside, why you not start with pregnancy, why you are not doing this and that. But in the end, we made a common decision with most of the people that we split up the different things in these different groups. So you can see here all the signatures where we were very proud and smiling that we had these famous people in the parliament. And there is also planned, of course, in the next couple of weeks and months and years, regular meetings in the parliament to knock on the doors to make these changes possible. And in 3 weeks, I'm invited at the G7 meeting. There are preparations of the G7 meeting in summer, and there is one big in Berlin in 3 weeks where I'm invited as parent representative to open the whole plenary on maternal and newborn health. And it's amazing to see that I am as a parent who nobody cares 10 years before about our voice are now opening the whole session of maternal and newborn health at the G7 health section. And that's crazy. I'm so nervous and I'm so excited about this development that also maternal and newborn health is now on the agenda of health at G7. That's unbelievable. And that's really a hard work what we all have done the last years. So we really worked hard, and I'm very proud that also all these chairs were so excited to hear what parents need. And you see here the parents work group where they decided to what they want to have implemented in the standards in each single group. And this was really important also for the parents to understand that this, sorry to say this, these white gods, these big names, want to know what we need. That was really a symbol on this meeting for them. So the website is already designed. At the moment, we start with the working group. So behind this website, they are working at the moment on this. And also the working groups, half of them are already invited. Half of them will be invited in the next couple of weeks. So we are in the process. Maybe some of you didn't receive an invitation, but got already information. You will be invited. So please be patient. They come the next couple of weeks, and then that we can start there. So what can you do? So it's always a homework when I'm speaking. So if you are a parent, if you know parent, and if there are parents in your mind who maybe are a person who could join the knowledge forum. So this is something where you can spread the message about this project. If you are leading or in a member of a supporting organization who should be involved in this project, let them know about the project and join this initiative, because this gives how much more we have, the more we can really put pressure on the different systems. And if you have information about existing guidelines, standards in your hospital, pathways you have, let us know, send us this information, because this is important to know maximum on already existing models that we can learn from each other. And this is a really big achievement as well. We have the opportunity now to be full partner at the next European Congress, a new one, it calls Jens. And we really have to thank again the Swedish guys. It was Mats Blenno who really pushed this forward, and Morten Breindal, and also Luke Zimmermann, who stand in front of the others and said, we need the parents also in this meeting. So we are now responsible for the opening and closing speech. We have 6 parallel sessions, 1 in NICU design, family-centered care, breastfeeding, patient communication, palliative care, religious support, and we have also 1 pre-course of what we have heard before about Inga and the top, and we are very proud to be really full partner, not only supporting, so I'm also there in the committee of the scientific committee. And it was a big discussion. I'm not a medical doctor, I not study medicine, but I'm there, and that's very fantastic. So, but you're not going home today not to do something. So the Socks for Life campaign for World Prematurity Day is running, and we combine now this project with the awareness, because we want to show what is the difference. Can you make a difference? And you can make a difference. You can make a difference in every single thing in your hospital, in opening and welcoming parents, in improving maybe your hygiene standards. You can think about rebuilding your hospital. You can start with follow-up, with everything what you think should be changed, and start and send the message. The campaign of awareness will be parallel to the standards of care. So in May, we will have a toolkit where we spread around the message, how to join it, and this will be a long-term project, and the peak or the high awareness day will be, of course, always World Prematurity Day, where you can celebrate then, where you make in your country, in your hospital, in your unit, a difference. And this can be a knitting club for grandmothers who knit socks for hospitals. It can be something really simple, so that you can join this project. And World Prematurity Day, if someone from you don't know, it's November 17. And the socks line is the symbol, or one of the symbols of this day. So please use this day for telling the people. It's not only here in this room, it's outside, and everybody has to know that 1 baby in 10 is born premature. And we want to really share this on our website so that we can see who is doing what and why. And this is my son Lucas, for example. He is now 18, and he was last year leading the campaign. He was born with 515 grams and is now next year doing his A-level. And so there are a lot of things what you can do, exhibitions with your heroes. You can really start with everything. So please join us and start with event. Maybe you get Beyoncé or George Clooney or whoever, but you can do something. So yeah, be active and stand up for our babies. Thank you very much.